My name is Austin Ejebo. I'm going to be talking about isosabidate mononitrate anti-angina medication, and starting from the left on this my patho map. Starting from the left, we know angina is a pain in the chest, and it is caused by atherosclerosis, which is associated with obstruction of coronary artery, decreases supplies of oxygen to the myocardium, leading to ischemia and myocardial infarction. So if you angina, there are some concepts surrounding angina. We have pains on the top right. In this blue house, you have pains as one of the concepts. We have three concepts: one, pain, mobility, and inflammation. So how does this relate to angina as a concept? So if you have an angina, definitely you're going to have pains because of the impaired perfusion and the narrowing of the arteries. So it's going to cause pains. So that narrowing of the arteries and the pains you have is going to lead to immobility. How does it happen? So it prevents that pains prevent people from walking and engaging or doing exercises, which we know exercise helps. Exercise help to exercise helps in central perfusion, and also it keeps the heart healthy. So when people are deprived of those opportunities, then it also doesn't go well. Then we have also inflammation. Inflammation is when the endothelial artery is damaged, which causes arteriosclerosis. So when this endothelium is damaged, and if there's inflammation, you are also going to have pains. So it's all connected. Now, coming back to the left side with the pathophysiology, then the first thing is to, you have to assess a patient. When you're assessing your patient, you do the vital signs, physical assessment, inspection, palpation, percussion, and auscultation, for airways, breathing, and circulation. Then you have to also check the medical history of that patient. So having done that, then before you could administer or check on how to administer a medication, you have to check the vital signs, also check the apical pulse of that patient, check the lab result. So checking that lab result, then administering medication, how are they linked? How did I link this one? When you administer a medication, you are also going to go back and check the therapeutic effect of that medication. You have to evaluate. When you are evaluating, you have to do physical assessment as well and check the ABC of that patient. So that is how I link that one. Then having said that, then you come back to this part and check the patient therapeutic effect response to medication. If the medication is working, then there will be increase in perfusion. In the greenhouse at the bottom here, there will be increase in perfusion. Then the pains will be relieved. There will be relief of chest pain. If it's not working, then the patient is going to be there will be progression in chest pain at the bottom right. At the bottom right in the gray house, there will be progression in chest pain, and there will be shortness of breath, anxiety, and diaphoresis. So how are these two connected? When you have the concept and this gray house, this blue house and the gray house, then here you have the concept that is related to pains and of angina, and here also you have how the medication is not working, the symptoms and the progression of the disease. So they are all connected with pains of angina coming from the pathophysiology. So when there is increased perfusion, if the medication is working, then it is linked to how I understand the medication is working. Coming from this side, then it's talking about the MOA of the medication, how the medication works. So if it relaxes the vessel and increases the blood oxygen supply to the heart and reduce the heart workload, then there's going to be increased perfusion and relieve chest pains of that patient. So then the patient will be okay. So that's how the medication works. So at the bottom left, then I drew an arrow that shows the concept of arrow link angina and its concept with a patient, arrow link progression of diseases, then the arrow linking MOA, the mechanism of action, link therapeutic effect. So that's the little I can explain about my Pathoman. Thank you so much, and I hope you enjoy my video. Thanks.